like taking supplements every day? Please come closer. This video is for you. Yes. Now, taking supplements every day is not a problem. But the problem is how most of you take these supplements. For example, ladies that take vitamin C. Do you know that if vitamin C is being consumed in excess, it is being broken down to a particular compound called oxalate, which builds up in your kidney over the time and eventually destroys your kidneys. Now, as an adult, both male and female, our body only needs 75 to 90 milligrams of vitamin C daily, and which you can equally get from just two oranges. If you take two oranges daily, you have gotten this amount of vitamin C that is being required of your body every day. However, some ladies, especially those ones that are into skincare, go ahead taking over 2,000, even more, including other supplements like collagen gummies that they take that still contains vitamin C. They contains all of this quantity of vitamin C, thinking that will do better. I am sorry, it's a very wrong way of thinking, because no matter how simple, how harmless that name supplement or vitamin sounds, if consumed in excess, can eventually become poisonous to your system. It is advisable you take just the amount that is being required of your body daily, so you won't be that weapon fashioned against your own body. For menses last for more than 7 days. Please, as a woman, it is important you see a doctor. Menstrual flow duration lasting more than 7 days, going 14, 15, that is no longer menses. What is happening to you is that you are bleeding. A normal menstrual flow duration should be within 3 to 7 days. Though some women have it for 2 days, it has been a norm for them. It has been happening like that since they started menstruation. That is not a problem to them. But if your menses last for more than 7 days, entering 10 days, 14 days, 2 weeks, 1 month, please, you are not menstruating. You are bleeding. It is important you see a doctor as soon as possible, because there are several things that could be causing that. Example could be that there is a fibroid in your womb, which you do not even know. You are not presenting with the symptoms. You don't even know that such a thing is there. It could be as a result of polyps, growths in your womb or in your cervix as well. It could also be as a result of hormonal issues. So please go to the hospital and see a doctor for this to be, to be evaluated and get fixed immediately. Okay? Bye. Things you should do and things you should not do when you are trying to get pregnant. Now, let's begin with things you should do. These things you should do it as couples. Number 1, you and your partner go and see a gynecologist. Book appointments with a gynecologist. If you haven't done that, go and do that. Number 2, please ensure you have done these 3 tests. You have done pelvic scan, hormonal profile, especially your progesterone, and HSG. With any other investigation, your doctor might be right for you. Number 3, take prenatal supplements. The ones your doctor will write for you. Together, ensure you are also taking folic acid. Now, let's begin with things you should not do. Talk about things you should not do. Do not smoke. Both partners. Don't drink alcohol. Do not take caffeine. Please reduce your sugary intake. Do not do rigorous exercise. Eat more of fruits, nuts, and green veggies. They will help you a lot. And avoid anything contraceptive. Avoid them. Bye. The misconception concerning the fertile cervical mucus. A lot of women are actually, let's say, misinterpreting it or getting it the wrong way. Seeing that fertile cervical mucus, something like this, it does not automatically mean you are ovulating that particular day you saw it. You may not be ovulating on that day. Now, this cervical mucus, you can start seeing it the moment you are in your fertile windows, like 3 or 4 days to the ovulation day. Some ladies may even continue to see it after the ovulation has happened. Whenever you are tracking your ovulation, if you're using only the cervical mucus to do that, you may be getting it wrong. If you want to confirm actually if you are ovulating or not, go for follicular tracking. This is where they use ultrasound scan to monitor your ovaries. It's quite expensive though. Another way, what you can test for ovulation using the ovulation test strip together with the cervical monitoring. Now, if you're able to use the ovulation test strip and 2 lines shows, it doesn't mean you are ovulating immediately. It means ovulation will be happening within 12 to 24 hours. Now, what you should know again is that sometimes there are conditions like a woman with polycystic ovarian syndrome. Even while she is not ovulating, if she uses that ovulation test strip to test, it's possible for it to show 2 lines even when it is not ovulation. This happens to women with polycystic ovarian syndrome. Now, this is why it is advised when you are tracking for ovulation, do not just use one method. Use your cycle length, the calendar method, where you minus 14 from your cycle length. Use that. Also monitor your cervical mucus, but do not totally depend on that cervical mucus, because some women, even when they do not notice that, it doesn't mean that that area will be completely dry. Even if they don't see that stretchy one often, some women can still be ovulating. They can still get pregnant. Another thing you should do, like I said, follicular tracking. It can also help. All right? Right. So someone asks, how can too much consumption of vitamin A during pregnancy cause birth defect to the baby in the womb? Vitamin A contains retinoic acid. Now, excess consumption of this vitamin A will lead to high level of this retinoic acid. And this retinoic acid affects the gene of the baby. And remember, the gene houses the hereditary of the baby, which is also essential for the development of the baby. When the gene is being affected, eventually the development of that baby is also affected, which will now lead to birth defects and other malformation. So this is how it happens. And also, any product you're using during pregnancy, try as much as you can to check if it contains retinol. If it contains retinol, please do not use it, because it can affect the baby in utero.